Hi, I'm John Zombro with The Lifetime Athlete, and today's video is all about interpreting shoe wear. Now, this is a topic that I've studied for going on 40 years, and it comes up very often in a collegial consultation when I'm doing some mentorship with a fellow physical therapist, coach, or trainer, and also working with curious athletes who are trying to unlock some of their pain or performance issues. So I'm going to jump right into the things that I have learned to look at in a shoe that I then combine with other data that I'm collecting or that you're going to collect as well, which would be your table tests, your motion analysis, etc. So first of all, when we look at the outsole of a shoe, primarily the main thing that the outsole is going to show us is two things. That's going to be initial contact of the foot with the ground. That's our foot ground or shoe ground interface, and our toe off. So let's talk about those just for a moment. Initial contact will generally, in the foot strike, be on the lateral heel or midfoot. Now, some of this is going to depend on whether you use your athletic shoe for a lot of walking, because if you're walking a lot in the shoe, you're going to see this as your primary wear back at the heel. But if you're using the shoe primarily for running or playing sports and you're more of a midfoot striker, that initial contact wear area may move up a bit onto the lateral forefoot. When we look at toe off, that's really what we should be seeing is an increased amount of wear on the medial aspect of the shoe in this area, which suggests we're pushing off or toeing off from the first metatarsal head and then out through the big toe. We probably don't want to see the wear be too much on this medial side, but more right up here at the point of the shoe. And also, if we see the wear of toe off being more lateral, that does suggest that someone may be pushing off from an underpronated or oversupinated position. And that could be a problem. Not always, but could be. So those are the two main things that we'll see. I should mention also that for athletes in sports other than running, you can still get a lot of great information regarding wear patterns. For example, a tennis player, you're going to see a lot of forefoot wear in the shoes because of people playing on the balls of their feet, which they should do. You also see probably evidence of toe drag if they do that during the serve or other things. So some of this is going to be sport specific and athlete specific, but we can always find things that are interesting and of value. Okay, so moving along, I want to talk about the midsole. So the midsole of a shoe, athletic shoe or running shoe, is generally the part that has the cushioning, and it could be made of different materials, but primarily of foam. Well, what we can often see, especially in a shoe that's got some wear in it, are compression lines. And so if we see the compression lines on the medial aspect, or excuse me, the posterior aspect of the medial midsole, that may suggest that a person is really compressing or pronating heavily. Let's say I'm hesitant to use the word excessive because with pronation, we're always thinking about three terms. That's rate, amplitude, and duration. So rate is how quickly that foot wants to pronate. Amplitude is how far, or magnitude, that it goes. And then duration, how long does the foot stay pronated? So if we're seeing a lot of compression, creases and lines in the midsole in the rear aspect, that may suggest that a person is pronating heavily or early. Where we typically want to see some compression in the worn shoe, the shoe that has some wear on it, is in the forefoot area, because again, that's going to designate that we're loading that inside ball, which is most appropriate for propulsion and locomotion. Now I'm going to move out of your way, and if we look at the heel counter, so heel counter here, this gives us an indication of what I'm going to call is a medial overstress to the shoe, or a breakdown that happens in the heel counter area. Now, one thing to keep in mind is that a lot of the modern shoes we use don't quite have the substantial heel counters of shoes in the past. However, we're going to still be able to identify changes in the orientation of that heel counter or heel material. And if it's rolling off, of course, this is a left shoe. I think I demonstrated that with a right. So let's see if I've got a right shoe here. Yes, I do. So this would be consistent where if this was broken down in that direction, again, that's going to suggest that maybe a person is overloading the shoe, doing a lot of heel striking, landing with a lot of force to then throw into the shoe and possibly break it down. So that may be something we want to consider. Now, when you look at the upper of a shoe, and the upper is primarily the cloth components that we're seeing, various fabrics. We don't see leather as much as we used to in the athletic shoe. We're going to see 2 or 3 things that are going to be interesting. First of all, you may see a medial scuff. And so what that would look like would be if the feet are contacting each other in the gait cycle. Sometimes we'll have this medial scuff where the material will be worn there as one shoe kicks the other. I think I can show this with 2 shoes. I think that would be better for you guys to appreciate it. So let's say as we're having this happen, we can get somewhere there. Not always a big deal, but it can suggest, well, maybe we have a difference in, we may have a person with just a very narrow base of gait as far as the spacing of the feet, but also we may have a difference in positioning. And so what I mean by that is there could be a weakness or a lack of mobility up the chain, possibly at the hip, which is causing that leg to take off and veer towards midline. It can also be related to a foot that for various reasons might be toed out a bit and then can come in and scuff the other shoe. But it is something to look at, especially if we see that pattern asymmetrically or only on one side. Now, what we have here is what I'm calling a big toe rip. And so this is just an issue in the toe box for most people, is that first toe, the great toe, or hallux, it may be confined in a toe box which is either too narrow and pinching or too shallow and not allowing enough room for it to function. And eventually the shoe will fail somewhere in this region, tearing out. So that's usually a sign of a shoe that just wasn't selected optimally or didn't have the best fit for the individual. Then we have the pinky rip. And that's an interesting thing because a shoe is lasted or shaped, and it can be straight, semi-curved, or curved. So in other words, that shoe can have an arc back towards midline, which is a curved last, or it can be much more straight. Well, if a person is wearing a shoe that has a bit more curvature than their foot likes, the shoe's always trying to go this way, and the little toe is always trying to go straight. It'll eventually tear free. And sometimes you'll see this. Again, this can be countered by good shoe selection and finding the last curvature or not that fits best for your foot. Then when we move over to the sock liner, the sock liner is also the insole, or sometimes it could be an aftermarket orthotic that you put in your shoe. But what this does is it behaves as kind of a long-term force plate. And it's especially valuable if you have a sock liner that's in a shoe that's got a lot of wear, and even it's had some dirt inside of it, because what will happen is the areas of greatest pressure where the foot's contacting will show up, they'll be compressed, they'll be smoother, and again, if the dirt's in there, you'll see that very well. So this is an interesting one that I like to examine a bit. We have this thing we call force progression, and I talked about that in a previous video where I was looking at how pronation and supination work in the foot, and I'll make sure I link to that in this video. But when you look at that wear or that compression, we want to see some amount of wear on the lateral aspect of the shoe. Again, this is going to be personal mechanics and speed dependent. A person who's going to be walking more or using a bit of a heel strike, and there's a lot of controversy there. We're going to see that back a bit, but then otherwise it's going to be a bit more forward on the lateral side. Then we'll see pressure start to increase through the metatarsal heads of the foot, but where we want that peak pressure is going to be the inside ball, because that's where we get our access to the propulsive power. That's what we want. And then you'll see an imprint there for the big toe as it's coming off. That shouldn't be quite as strong as this one. So you can make a lot of interpretations. If you see a lot of pressure that's lateral, and you see indentations of the lateral toes, but not the inside. That again can suggest a person's not accessing first med head, not pronating adequately. Also, if you see the breakdown or the pressure be very, very medial and going this way, that's going to suggest that medial roll-off, which I've talked about before, where a person is loading in a push-off phase with a very pronated foot. So we want the foot to be somewhat pronated, but we want it to be resupinating. And so if the breakdown is too medial, we may be pushing off on a flexible foot, and that can cause tissue stress and other issues. So those are some of the main things that I look at when I'm examining an athlete's shoes. And I always like to use this not as a sole examination, but as a composite of what I'm trying to do to help a person conquer pain or performance issues. And again, when we take our motion analysis, we look at gait, we look at movement patterns, we look at posture and position, we do our table test for whatever that may be, joint mobility, range of motion, palpation, etc. We want to use these bits of data to correlate and then come up with a better or more effective or more accurate and optimally fitting strategy for the athlete that we're trying to help. So that's a bit on shoe wear, and if you have questions or comments, please feel free to post those in the comments section or reach out to me at thelifetimeathlete.com. I am always happy to go deeper in the subject. In fact, that's what I do in a lot of my coaching consultations with athletes and colleagues. So thanks for your time today. This is Coach Jay-Z signing out from The Lifetime Athlete.